On the 7th of February 2020, the Minister of Health and Childcare, Dr. Obadiah Moyo, visited the Joshua Nkomo International Airport in order to assess the airport's preparedness to identify and screen for the 2019 novel coronavirus, as well as what to do should a traveler present with signs and symptoms of the virus.
I had a very extensive tour of this airport. It's a fairly new airport. However, there are some issues which we have decided to be rearranged. Basically, they've got everything that is necessary for them to be able to identify and pick out, and improve on the control of avoiding coronavirus carriers getting into Zimbabwe. That is what the purpose of this visit is. We want to strengthen our ports and see what assistance we can be able to give them. So here at Joshua Nkomo Airport, they are well prepared. They are ready to be able to pick up anyone who's got that virus, but we also give them further knowledge on how they can improve on their systems. So the airport manager, Mr. Dewa, is going to work on that, and together with our provincial medical director, and the port health authorities, they are here. Everybody, we sat with them and we went through stage by stage, educating each other, making each other knowledgeable on what should happen at each and every stage.
The minister was then joined by the Ministers of State for Provincial Affairs and Devolution for Bulawayo and Matabele North provinces as they toured the Thorngrove Infectious Hospital.
We are here to work as a team. It's a team effort, and we are very happy, with the what we have been shown here. They will definitely need further assistance, and we have said that we're going to also arrange for some training in Harare, and I'm told that Dr. Nyati is already in Harare, going through some training. We want to make sure that this unit will be a proper isolation unit. So there is more equipment that we identified, which we need to send over here. The protective equipment, we want personal protective equipment, one more to come to this unit, and also the masks, and the gowning area, we must identify that, and make sure that if we need to do further partitions, we'll do that. But the unit as it is right now is adequate for the purpose of isolation. 2019 novel coronavirus is there on Earth right now. You see, so it's not yet a pandemic. It's still confined mostly to China, but there are other countries which have also been affected through movement. So that's why we started by going to the airport. So after the airport, we are following the movement of that patient, that traveler who will have been caught with the virus at the airport. We want to know exactly how it's going to happen here in Bulawayo. So we've been to the port, and then the port, they do the detection, right? Check on temperatures. After that, they've got a holding isolation unit there as well. At the airport. While they are waiting to move the client, they have got that unit, and then the client will eventually come here for a longer period, and for treatment.
The ministers then traveled to Plumtree Border Post to tour and assess the border post's preparedness for the 2019 novel coronavirus.
We are here at Plumtree border, our border with Botswana. This is the main border. I know that there's another border further south, and we decided to come to this one first because there's a lot of traffic going through here, and we do not want to miss any case that might escape through if our borders are porous. Porosity is in terms of how we are actually controlling the borders ourselves. Are we doing all the correct things? Are we making sure that our staff are well trained on what they should be doing, on the checks, on temperature, on how they will be able to handle a case if suddenly the thermal detectors pick up a client who has a high temperature. Again, we've emphasized the need for team effort from immigration, police, defense, whichever department, customs. We are all here working on this border, and we have to work and help each other to be able to achieve a situation where 2019 novel coronavirus does not get into Zimbabwe.